Sleep deprivation's silent impact, unveiling its immediate and long-term effects on health. The grave consequences of chronic lack of sleep. Lack of sleep, also known as sleep deprivation, can have profound and wide-ranging effects on the human body and mind. This video will provide an in-depth overview of the consequences of sleep deprivation on various bodily systems and the potential worst-case scenarios associated with chronic sleep deficiency. 1. Central nervous system. Sleep is essential for maintaining cognitive functions. Lack of sleep can lead to various cognitive impairments. You might experience difficulties with memory, concentration, decision-making, and problem-solving. Your reaction time may slow down, increasing the risk of accidents and errors. Chronic sleep deprivation can lead to a constant state of mental fog, confusion, forgetfulness and lack of focus, and can contribute to mood disorders such as anxiety and depression. In extreme cases, long-term sleep deprivation can lead to hallucinations, delirium, and severe cognitive dysfunction. There is also an increased risk of developing neurodegenerative conditions, such as Alzheimer's disease. 2. Cardiovascular system. Sleep plays a crucial role in regulating blood pressure and maintaining cardiovascular health. Sleep deprivation can lead to elevated blood pressure and an increased risk of hypertension, heart disease, and stroke. It also disrupts the balance of various hormones that influence cardiovascular health. Chronic sleep deficiency can contribute to atherosclerosis, the hardening of arteries, heart rhythm disturbances, and inflammation in blood vessels. In the worst-case scenario, long-term sleep deprivation can increase the likelihood of a heart attack or a stroke. 3. Endocrine system. Sleep deprivation disrupts the endocrine system, which is responsible for hormone regulation. It can lead to insulin resistance and an increased risk of type 2 diabetes. The hormone leptin, which regulates hunger and appetite, decreases, while ghrelin, which stimulates hunger, increases. This imbalance can lead to overeating, weight gain, and obesity. Over time, these metabolic changes can result in a range of health issues, including diabetes, obesity, and metabolic syndrome. 4. Immune system. Sleep is essential for a properly functioning immune system. Lack of sleep weakens the immune response, making you more susceptible to infections. It can also impair the body's ability to fight off existing infections effectively. Chronic sleep deprivation can lead to a higher likelihood of getting sick and experiencing more severe illness. In the worst-case scenario, prolonged sleep deficiency can contribute to the development of autoimmune diseases and make it difficult for the body to recover from serious illnesses. 5. Musculoskeletal system. Sleep is crucial for muscle repair and growth. Insufficient sleep can lead to muscle fatigue and decreased physical performance. It can also result in an increased risk of injuries and accidents due to impaired motor skills. Over time, chronic sleep deprivation can contribute to chronic pain conditions, such as fibromyalgia, and exacerbate existing musculoskeletal issues. 6. Gastrointestinal system. Sleep deprivation can disrupt the normal functioning of the gastrointestinal system, leading to digestive problems like acid reflux, indigestion, upset stomach, and irritable bowel syndrome. It can also contribute to weight gain and obesity due to hormonal changes that affect appetite and metabolism. In the worst-case scenario, chronic sleep deficiency can increase the risk of developing gastrointestinal disorders and exacerbate pre-existing conditions, such as inflammatory bowel disease. 7. Respiratory system. Sleep apnea is a sleep disorder characterized by repeated interruptions in breathing during sleep. It's often associated with obesity and is aggravated by sleep deprivation. If left untreated, sleep apnea can lead to various respiratory and cardiovascular issues, including heart disease and high blood pressure. In extreme cases, untreated sleep apnea can result in severe complications and even be life-threatening. 8. Reproductive system. Sleep deprivation can disrupt hormonal balance and lead to reproductive health issues. In men, it can reduce testosterone levels, affecting fertility and sexual function. In women, irregular menstrual cycles and fertility problems can occur. Chronic sleep deficiency can contribute to reproductive disorders and, in some cases, lead to infertility. 9. Skin and appearance. Lack of sleep can affect your skin's appearance. It can lead to premature aging, dark circles under the eyes, and dull, dehydrated skin. This is because sleep is the time when the body repairs and rejuvenates the skin. In the worst-case scenario, chronic sleep deprivation can accelerate the aging process and lead to chronic skin conditions. 10. Psychological well-being. Sleep deprivation is closely linked to mental health issues. It can exacerbate symptoms of anxiety and depression and make it more challenging to manage stress. In the long term, it can contribute to the development of mood disorders and increase the risk of suicidal thoughts and actions. In the worst-case scenario, untreated sleep deprivation can lead to severe mental health disorders and have a profound impact on one's overall quality of life. Worst-case scenarios. Chronic health conditions. Prolonged sleep deprivation can lead to the development or exacerbation of various chronic health conditions, such as heart disease, diabetes, and obesity. Fatal accidents. Sleep deprivation is a significant risk factor for accidents, especially in professions where alertness and concentration are critical, like driving or operating heavy machinery. In the worst-case scenario, severe accidents can result in injury or loss of life. Mental health crisis. Untreated sleep deprivation can lead to severe mental health issues, including suicidal thoughts and actions. In the worst-case scenario, it can lead to a mental health crisis that requires immediate intervention. Physical and cognitive impairment. Chronic sleep deficiency can result in a severe decline in physical and cognitive abilities. In the worst-case scenario, this impairment can lead to a loss of independence and a reduced quality of life. Reduced lifespan. Long-term sleep deprivation is associated with a higher risk of mortality. In the worst-case scenario, a consistent lack of sleep can lead to a reduced lifespan. It's important to emphasize that acute or short-term sleep deprivation can usually be reversed with adequate rest, and the effects are typically less severe. However, chronic sleep deprivation, which can last for weeks, months, or even years, is of more significant concern and can lead to the worst-case scenarios described above. To prevent the adverse consequences of sleep deprivation, it's essential to prioritize sleep and practice good sleep hygiene. Aim for 7 to 9 hours of quality sleep per night, create a comfortable sleep environment, and establish a regular sleep schedule. If you suspect you have a sleep disorder or are struggling with chronic sleep deprivation, seek guidance from a healthcare professional or sleep specialist to address the underlying issues and improve your sleep quality. Thanks for watching. Please subscribe to watch more video like this.